Any board comments?
I will make.
You're already out of time, sorry.
I will make. Excuse me. So I've listened to and heard the many reasons given for opposing mask requirements and other safety protocols, and a common thread seems to be a mistrust of science. This mistrust in science, coupled with the immediate politicization of COVID-19, has played a crucial role in the response to COVID-19. Unfortunately, the control of an epidemic disease relies on public compliance with government decisions and scientific advice. In order to protect public health during the pandemic, the public must be counted on to trust government decisions, and political leaders must be counted on to trust the findings of the scientific community. While some skepticism in political and scientific authorities is healthy because it encourages debate and contributes to policy improvements and prevents accepting decisions at face value, during times of a fast-moving pandemic, trust is critical to citizen compliance with public health measures. However, as the number of infections surges once again and the mistrust of science by some continues, we find ourselves still being bogged down with debates on masks. The philosopher David Hume argued in his Treatise of Human Nature that reason is and ought only to be the slave of the passions, and can never pretend to any other office than to serve and obey them. Now, Hume is not saying that reason is unimportant. However, he's saying that reason alone does not move one to act. The force that propels one to action is the passion, whether it be love, anger, pride, envy, fear, or desire. The masking debate seems to prove Hume to have been correct. Facing unknown situations with emotions running high, many people also exhibit confirmation bias, which leads them to look for and accept information that they already decided is the truth. I've had plenty of such information shared with me from a vocal minority, and without much effort, I found most of it to be erroneous and based on poor science. The board and administration have repeatedly been accused of not having the best interests of the students in mind when it comes to masking policy. But other than providing a safe environment with the goal of keeping schools fully open during this pandemic, I'm still unclear as to what the motivation is for following major policy organizations like the CDC that have recommended community rates be used to make decisions related to in-person education, as the district has done with regards to masking. So what do such organizations say about masking in schools? Pediatrics, the official journal of the American Academy of Pediatrics, pre-published an article that has undergone peer review and has been accepted for publication. Researchers examined more than 100,000 students and staff in 13 districts, implementing mitigation strategies and tracking within-school transmission of SARS-CoV-2 during a surge of infections in the state of North Carolina. 12 of the 13 districts implemented minimum physical distancing in pre-K through 5th grade for at least part of the day. All districts offered in-person education for at least some middle and high school students, and all 13 districts permitted extracurricular activities. The study showed that with adherence to masking protocols and some distancing, school-acquired SARS-CoV-2 is uncommon in a school setting, even with high community infection rates. Research. Actual research like this is why I believe masks should be mandatory when virus levels are high. Dr. Mike Smith, professor of pediatrics at Duke University, who co-authored the study, said, "Vaccination is number one, but masking is number two, and therefore the most effective way to reduce spread of COVID-19 in settings where people, including children younger than 12, cannot be vaccinated." The American Academy of Pediatrics has consistently supported universal masking for all vaccinated and unvaccinated children and adults in schools. If the AAP doesn't have the best interests of children in mind, what is its motivation? Dr. Tina Tan, a pediatric infectious disease doctor at the Lurie Children's Hospital in Chicago and a coronavirus expert with the Infectious Disease Society of America, explains the motivation, saying, "What we want is for teachers, staff, and students to be safe. If they want to go to in-person learning, masking has nothing to do with politics. It has everything to do with public health and safety." Now, I'd like to address a few of the myths about children wearing masks that I've heard from several emails. One of the myths: young children aren't capable of keeping masks on all day. The fact is, in the North Carolina study, there was a 90% compliance, And what we've learned over the last year that the youngest children are actually better at masking than older children. Children with parents who do not understand the reasons for wearing a face mask are less tolerant. The key is setting the example. Another myth is that children don't need a mask in schools because they don't get COVID-19. The fact is, with the Delta variant, makes up 90% of new cases as of August 18th, and the rate of children contracting the virus has risen accordingly, and hospitalizations have tripled from May 1st to August 8th for children under 17. Another myth, the carbon dioxide and toxins build up when masked. Fact is, oxygen and carbon dioxide molecules are significantly smaller than even the smallest viral particles and droplets captured by masks, meaning that they easily pass through the mask. Note that no one is claiming that masks are 100% protective. The main purpose is not to protect the person wearing the mask, to protect others. That is why universal masking is recommended. Additionally, masks do not build up mold unless left wet and unwashed. We already have insight into what we can expect when schools open without masking in areas with high levels of virus. There have been 20,000 quarantines across the state of Mississippi and 10,000 in one school district in Tampa. Hospitalization for kids under 17 are up 22% across the country, and new records are being set each week. The truth is, the majority of parents support universal masking in schools, with a vocal minority opposed. As we hear more and more regrets from those who didn't trust science and were opposed to masks and vaccines until they personally experienced the downfalls of being infected with COVID. We should learn from their experience so we don't have to have similar regrets. That's why, until vaccines are available to all our students, I will support following the recommendations from leading public health organizations and support the thresholds put in place to determine masking requirements for our districts. I hope others will too. Thank you.
Thank you, Jim.
Jumping into my COVID update, I do want to make sure that during this time I provide some clarification on some things that were confusing in the work that we did 2 weeks ago. And I also want to just report where we are with COVID activity in the geographic boundaries of the district, the region, and the district. The data that I share with you about what's happening in the school district is only involving students who are involved in on-campus programming or staff. And as you probably know, at this point in the school year or the summer, we don't have a lot of students that are involved in on-campus programming. Primarily, it involves a few sports teams and some limited music groups over the past 2 weeks. We did have some case activity soon after the August 9th meeting, but that case activity is now outside of the isolation period. And so we have zero case activity with those students who are involved in current student on-campus programs or staff. The second chart that I shared with you is the geographic boundary line graph that I've shared since last October. You can see that there was a small, you can see the increase that we've had since early in the summer, and then another increase that's happened since our last meeting. Fortunately, we've started to see a decrease in that trend line, and I'm optimistic that we're going to continue to head that direction as we prepare to welcome students on the 1st. Our families have access to our weekly update of the Sauk Prairie School District geographic boundaries, new cases per 100,000 residents. And you can see that, unfortunately, right after our last meeting, the Wednesday data release moved us into the high level of community transmission, and then we went up again last week. One thing that was confusing for some, and I do want to make sure I provide this clarification, is that this is all new cases in the last 7 days. It's not the average number of new cases over those 7 days. And so it's looking at the total new cases in the community over the last 7 days and then translating it to a per 100,000 person metric. I also provided the data for the county. The county did go down slightly at last week's report, but still is in the high area of transmission. The two things that I want to provide is additional clarification about these thresholds. And Rachel, I want to thank you for bringing up one of the topics and provide some clarification. The threshold number 1 that talks about school or classroom activity is not a per 100,000 metric. What I really hope to use that one for is immediate response to something that's happening in the classroom right now. How do I temporarily address that problem? An example that I used in the documents of families 2 weeks ago was all of a sudden we've got 2 or 3 students coming down to the nurse's office with similar symptoms in the same second grade classroom. Can I get that whole second grade classroom outside for the rest of the day? That would be my first choice. It is the safest space. If for some reason I can't, it was like this morning when it was raining outside, where can I put them where maybe we can maximize social distancing? So could I bring a second grade classroom from up in the green wing and bring them into this space for more of the day, or use the library or some other larger space? If I don't have those options, let's look at temporary masking until we get results back, hopefully in the same day, to determine whether or not it's COVID positive symptom activity or it's some other symptom. But I appreciate you bringing up the question of whether or not it's per 100,000, because you're right, at a school like Merrimack, one person sneezes and they get 100,000. I mean, it's only 135 kids in the building. And so we'll use absentee rates like we did last year with the health department. When we saw 10% of a school or 7.5% of a school all of a sudden absent, we did an investigation with the health department every time to determine what's the story behind these absences. And they asked us great questions to figure out, like, literally, let's go through every kid on the list. And fortunately, most of the time, we were able to say, this student's already been tested, it's negative. This person's tested, negative. There seems to be some sort of flu bug going on in this family, and because there are 4 kids in this school, that's what happened. But it's not a per 100,000 metric. And so let me help, because I was asked that question by several people over email and phone call over the last week and a half. I want to make sure I provide that clarification. Thank you for bringing that up in here, Rachel. The per 100,000 only fits the geographic boundaries of the district and each of the counties. We're only choosing to use Sauk County data because Dane County is so disproportionately influenced by the Madison metro region and the large suburbs that it really is hard to use that data to inform what's happening on the immediate other side of the river to inform Sauk Prairie's decision making. Sun Prairie would have way more influence than Sauk Prairie if we use Dane County data. There was a little confusion about, so you mean to tell me that on Wednesday evening you're going to make a decision for Thursday? Like, there's got to be a better way. And we got lucky because the state changed the way it reports data over the past 2 weeks. And so I will make sure to send out this link to our community. But now that the state is releasing, it's going to be silly for me to show you this really from that far away, but it's a per district map in real time. What is the color code for every district in the state of Wisconsin? So when I look at Sauk County's school districts, the good news is that there's one of those districts that is now, as of today, in substantial transmission, while the rest have gone up higher and higher transmission, and it's us. So Sauk Prairie, 100 is where you hit high transmission. According to the state this afternoon, when they released the data, I got this at right around noon today. We're at 98.7. So we're not far away from that 100 mark. But 2 days ago, last Wednesday, if I go back to the numbers I reported earlier, last Wednesday we were at 147.8. And so we have had a significantly smaller number of new cases reported over the last few days, which has had the good impact on our 7-day case rate per 100,000 of dropping us from high to the very high end of substantial. I'll take that as good news, even if it's not all the way there. But we're heading in the right direction. So what this would mean is if this trend continued, and I certainly hope it does, that what threshold 2 says is that when we reach back to moderate or low transmission, I don't need to come to the school board and say, will you take a vote on whether or not we go back to mask optional? But instead, that means we've reached the levels where the UW Department of Pathology and Laboratory Studies and others have said, you've reached a level of community transmission that's low enough that you can make mask optional in your schools. It does not require us to have threshold 1, COVID activity, also at like 0. But what it could mean is that I could declare mask optional with my team because we reach moderate or low, but I have one school that continues to have some suspicious COVID activity, and until I know what's going on in that one school or that one classroom or that one grade level, we're going to continue to mask. I really see threshold 1 being the immediate response to something that we identify that day. It's not looking at a 7-day average or a 7-day total. It's looking at what's happening right now. We've got those second graders that are coming down to the office. They're symptomatic. What do we respond to right now to limit the risk? And it doesn't have to hit a per 100,000 threshold to make it work. And then the third threshold, which now we also get the data every day instead of having to wait for certain data releases, is the least influential, but we still can look at what the trends are in the county. Now, I'm not going to, because I can also look at the school district numbers, I can see where are the hot spots in the county. I would not want to send my athletes, even right now, to compete in the Wisconsin Dells with a level of COVID transmission per 100,000 compared to us. They're over 3 times the rate of activity, with Reedsburg a close second. But now we can look and say, if the county's still at high, is that a Sauk Prairie thing? Is that a Baraboo thing? Is that a Wisconsin Dells thing? Is it Weston disproportionately influencing the county? Where is this coming from? To help inform our decision, but not be our decision. One of the things that what changes because of this map is that I'll communicate this before school starts. Instead of changing on Wednesday night for Thursday morning, now the state gives us access to this every single day, so we can make decisions at the end of the week for weekend activities in the following week, instead of having the confusion of making an announcement on Wednesday night for a change Thursday morning. I think that will help prepare kids for changes, give us time to reach out to families, make sure that there's expectations that are clear for Monday, instead of changing midweek, which we had to do based on how we were collecting the data and able to report it. But since our last meeting, the state has changed the way it's reporting its data. It's the same numbers, but now they're available all the time with an update midday. And I'll send you that link so that you can keep track of it too, because it is interesting, and right now, fortunately, Sauk Prairie is heading in the right direction. So those are I guess the few main things I want to make sure I clarified, and the things that I owe to the parent community and families then in the next few days is to give access to this map from the Department of Health Services, so everyone can be tracking this right along with me and our nurses. And also explain that instead of using a Thursday to Wednesday practice, which was inherently confusing, but it was the best we could do with the data we had, now we'll be able to shift that to the end of the week to do a full, for most students, it'll be a Monday through Friday change. It would only be students who are involved in weekend activities, like certain athletes and others, that will be affected potentially by a weekend change. Those are my COVID updates. There are a few dates that Melissa put at the end of the agenda, and as President Judge mentioned earlier, if you have an interest in attending the regional meetings for WASB, please let us know so that we can get you a spot reserved for those October meetings. Questions before we move on?
I have one question regarding parental concerns with students who are physically, mentally, or because of specific educational needs are unable to wear a mask. What suggestions or what do we have available?
This protocol that we wrote last school year also included options, realizing that not everyone can wear a mask the same way based on unique abilities. My suggestion would be, if it's involving a special education need that's already been identified, that a parent would probably already know who the case manager is or the lead teacher for their child. And I would suggest that since all the teachers will be back with us later this week, to reach out to that teacher. If you have ongoing questions, Dr. Noelle Sapiro is our Director of Student Services. She is working with me on these all the time and can help make some adjustments. We met about a student even this afternoon just to make sure that we knew how to support that family and their unique young learners' needs coming into school. But I would start with the person who knows your child best. which is probably the case manager. And then if you have other questions, or you don't have a student with a special education label but still want to reach out, I'd suggest like calling our district office and talking with Dr. Zapiro or Dr. Kulo, somebody in our district office team, until all of our teachers return later this week.
Thank you.
Yep.
Additional questions? Anyone? I guess I would just, not really a question, Jeff, just some brief comments. I think there's a tendency in all of this to look at it as kind of an either or. What are we talking about right now? It's masks or not masks. And I'm maybe being a little nostalgic. About a year ago at this time, we were meeting in the gym here with a much larger crowd. And the question was, it was a little earlier than this, were we going to be back in school in person, or were we going to be once again in a virtual mode for the beginning of the school year and possibly for half of the school year? And it was an open question. We didn't know where we were going to be. And there were a lot of voices on both sides of the issue. And there were a lot of loud voices that wanted us to take the most cautious approach and to resume full virtual instruction and to wait before we brought kids back. But looking at our experience in the initial parts of COVID, while certainly folks did a great job in a very difficult situation, it was far from optimum to be in a full virtual environment. Kids suffered loss as far as their academic instruction, their social development, and their mental health by not being in school. And so we made it a priority to get kids back in the buildings so that they could be in a classroom, so they could have instruction. And that was, there was quite a vigorous debate. It was not an easy decision. If we had followed I guess you'd say the volume in the room, we would have gone full virtual last year. We would have started our school year at least at the beginning at full virtual, but we didn't. We made a calculated risk, and we decided that while we want the kids to be safe, that there had to be some kind of a marriage that we could have between reasonable protections and public safety for their health and safety of the kids and the staff and their parents and the community at large, and also providing an educational product that would be as close to normal as we could possibly get, and better than that which we had offered in the spring before, and recognizing the shortcomings of a complete virtual environment. And that's what we did, and it was a close call. And I think it was the right call. Ultimately, we traded off a little bit of risk for a lot of folks, or a lot of kids being able to get the instruction they needed, and to get some of our special needs learners back into the classroom and back into that intensive one-on-one that is so essential. And we were fortunate that we got through the entire school, almost the entire school year, before we had one verifiable case of school-based spread. But we had hybrid instruction model, we had face masks, we had a whole stew of preventative measures that we used to get there. Towards the end of the year, we went into full in-person instruction. We also had to have trade-offs there. We made masks mandatory so that we could bring back more folks into the classroom. It was a trade-off because ideally none of us would have these things on our face. But that was the cost of getting kids back into the classroom, which was a priority. And there were plenty of people who will tell me and continue to tell me that I'm a horrible person because we're taking risks with kids' lives by saying these face masks are not enough, and we should still be in a hybrid model, and we shouldn't have all the kids back at school, and we should be doing all kinds of things to make this thing more safe, and to be absolutely certain that we are doing every single thing that we possibly can. But again, we need to have these kids in school, and we need to have all these kids in school. And that has been the priority of this district, to get kids back in the classroom and to get as many of them there as possible with as few restrictions as we can possibly have, so that we can try to make up for some of the ground that has been lost, because many kids have lost ground. Some have made up a little bit extra, but to start to get that back. And for those kids who have suffered social development problems or isolation problems, to help to mitigate some of the damage that's been done with that. And we can't do that if they're not here. And if they're not here because we're in quarantine all the time, and they're not here because we have to keep shutting down this building or shutting down that building, that defeats that purpose. It undermines that strategic goal. And that's what we're seeing across the country. Jim referenced it in Florida, in Mississippi, in Georgia, school districts that are seeing hundreds, if not thousands of kids put into quarantine, once again, sent home, so they're not in school, they're not getting instruction. Sure, they're getting some kind of virtual instruction, but is it the same? No. And so, I guess there's two ways to look at this. You can look at this as a win and loss. You want a mask. Some people want masks, some people don't want masks. That defines the winners or losers. Or you could say that maybe this is a marriage of some good things and some bad things, and we're all getting a little bit. Now, some districts around us have taken a one-size-fits-all approach and said it's either mask or no mask, and they'll come back and they'll decide later on whether that's going to change. We've taken a much more nuanced approach that actually says we're looking at data and puts out there as when we get to a place, masks will become optional. And at that point, we'll have those acceptable risks. And there are plenty of people who will, I'll probably hear from them tonight when I get home. They'll say, you're putting our kids at risk because you're saying we're going to have those kids come back and masks are going to come off when we get to low or moderate. But you know what? An old boss of mine once said, I was complaining because we had made some very serious changes in policy. And I said, look, everybody's tearing me up. Nobody's happy. There isn't anybody who works for us who's happy right now. He said, well, that's the sign that you're doing the right thing, probably, because if everybody was happy, you probably weren't being tough enough. If only half of them were happy, you were making the wrong decision. But right now, you can look at this in the framework of, I'm not going to be happy until there aren't any masks. There are other folks, and they're just as numerous, who would prefer us to have masks for the rest of the year, regardless of what the numbers are, even when we go down to low. This is kind of a middle ground, and it's a much more nuanced middle ground than a lot of districts around us are having. And based on some conversations I've had with school board members from other districts, I would not be surprised to see our model operating in a lot of districts around us in the near future. So it's not perfect, nothing ever is, but keep in mind that the goal here isn't to determine whether kids have masks or whether kids don't have masks. It's to determine whether kids are going to be in school and whether they're going to be getting instruction in classrooms from their teachers and being there with their friends and being out on the playing fields and playgrounds with their friends. And that's our goal. And you can be ticked off about that, that's fine. That's human nature. Go ahead, be mad about it. I'm mad about things too. We all get mad about things. But I'd ask you to try to look inside and recognize that sometimes it's not going to be everything you expect it to be, but it might be pretty good. And having those kids in school, I think next year, or this coming year, I have kids, I should probably know when they're coming back, right? It's going to be pretty good, I think. And I think the kids are pretty excited to be going back, for the most part, which I don't understand. That's never how I was. But I think a lot of them are excited to be going back, and I think it's because they're going to be together. These things that are going to be on their faces, and hopefully are going to come on and off whenever we have the problems, I hope they're off as soon as they can be. I don't think this is their main concern. Their main concern is, are they going to get back in that classroom? Are they going to get out on that playground? Are they going to be on the playing fields? That's really what matters. And I guess we're trying to keep our eyes on that prize. So